And it takes partnerships. And one thing I try to meet every quarter with every elected official, supervisor and mayor in Albany County, but I also meet with my counterparts. And I have the unique distinction to be president of NYSAC, New York State Association of Counties, so I meet with all the county executives here, but I'm also president on a national level. But it really brings us to a point what I make is that we roll up our sleeves and we see how we can work together. So Mark Pollenkarts and us, and he's the Erie County out in Buffalo executive. That's when we came up to Dine and Go, and we both submitted for it, and we put in for the grant, and we received it. And it's a program that you enjoy today. And it was a 2-year thing from the state of New York, basically to see if this would work. And I think it's been a huge success. Yes, no, maybe?
That's those ladies out there.
How do you think about it? One of the issues that we talked about is like when you have conjugate meal sites throughout the county, and there's nothing wrong, it's the same people. We thought, wouldn't it be neat if you could go out with friends and go to a restaurant and sit down and go wherever you want to go and either be with your family, friends, if you're dating somebody or want to date somebody or want to get rid of somebody, it's better do it in a nicer restaurant, right? And the program's worked. And actually, when I'm getting yelled at, from people that they want more of it, yeah, you. And legislators are like, we got to do more. It's great because it has been a really great program. So, the grant runs out this year, and we got to reapply and we got to look at it. And I'm hoping that the state sees the impact it has had on the community, because one of the biggest issues, obviously, as you age, is isolation. And we've talked about isolation because a lot of seniors, the only time they get out is when they go to the mail sites or someone's checking in on them. And it has shown that actually smoking a pack, I think it was a pack, Mary, you can correct me because I'm going off my memory on this, a pack of cigarettes a day is better for your health than a senior that's isolated by themselves, because their health deteriorates, isolation, dementia, it all comes into play because they have no one around you. So these are things we're trying to change and improve, but we can only do it by getting feedback, working with, and again, before I even go on any further, I do want to thank the legislators that are behind me, because without that partnership, this stuff's not possible. Without talking to them and working with our Department of Aging and approving the budget, we wouldn't be sitting here right now enjoying this thing. But it gets me to the real reason why we're here, and actually there's a couple things we have to work on, but one of which is the doctor is in. So one of the things is the other thing, getting out to doctors or hearing healthy things. So we decided, and Deb, I want to say Deb's done a great job on this, and I'll talk more about it, is we're going to have a doctor once a month throughout the county. We're going to pick different sites to go and talk about a variety of topics, either be about your heart health, high blood pressure, whatever it may be, diabetes, stroke, just signs of aging. So we're going to do it throughout the community and make it possible for you to hear from a doctor and ask them questions that you might not have the time if you're in a doctor's office to find out about. So that's going to be our first presentation today. The other thing we're going to do is, Deb's going to kill me, is that we have this renowned, we're doing this in a partnership with Saratoga County, Rensselaer County, and Schenectady. And we're bringing a renowned person in to look at dementia. And actually this person does dementia care worldwide. And the person that's coming in is going to be June 4th.
Last year, 2 years ago, we reorganized the committees as far as the standing committees of the legislature. And one of the things that I did recognize was the growing population of the seniors. So we changed the rules of the legislature and we added the elder care committee. And that was one of my pieces of legislation, Ms. Padgett. So I felt that we needed to separate out the issues involving seniors because it was getting lost. And it wasn't just getting lost locally. On the national level, it's lost when they come to start looking at issues. They had us lumped in with early intervention programs. And for those of you who don't know what early intervention programs, they're for infants up to 3 years old. And so our issues were being lost and lumped in with a group that I felt, well, we needed unique care, unique attention being paid to what the needs were for seniors. The other things that I realized too, when you're on the road and you're out there campaigning, and I went to Danny about was our people in Albany County and our seniors, their issues are the same. It doesn't matter whether you're black or white. Bones and arthritis knows no color. And also the fact that we needed different programs around the county, and especially in the city of Albany too, because here we are in the town of Guilderland. And so we want to make sure, and he wanted to make sure, that programs were being evenly distributed as far as our seniors were concerned all over the county. And so we are very happy today to be a part of this unveiling of the different programs that are going to be made available to our seniors. So I just want to thank the Department of Aging and Deborah Tano, and I also want to thank our county executive too for listening to what you had to say, what you told us what the issues were. We brought it back to them, and they are doing something about it.
Good afternoon. I'm so glad to see all of you. I'm very happy that we could combine the Go and Dine program with this today. We did have a few snags, but I'm glad that we're all here now. You can, before you go back, you can get your blood pressure checked. I want to make sure that you know about that. We also had some giveaways that you saw, and at the end we're going to have a drawing because someone donated several prizes that you get to take home with you. First, I want to thank our county executive, Dan McCoy, for being with us today, and it isn't easy, and he has a very tight schedule, and I know that. I do try to be respectful of his schedule, although it didn't show today, but it will show in the future. I can never really enumerate to you all the ways in which Dan supports older adults in Albany County. And now through the Capital District Caucus, Albany is changing the narrative on aging, and our Capital Region Caucus supports seniors across the region as we continue to collaborate with surrounding counties. So Dan's influence really seeps into all the surrounding counties, that Schenectady, Rensselaer, and Saratoga. And we're delighted about that because that really is something that hasn't happened in the past, and it's happening now. Thank you to Sharon Hodges for taking blood pressures today. There's going to be lots of new pop-up events that are going to be coming, so you need to stay tuned to us. I hope you're taking advantage of the blood pressure service today. I am not, because I'm just crazed. And thank you to Jane Ginsburg of Jewish Family Services for getting us acquainted with Sharon, who is doing the blood pressures. And I want to thank my staff, Matt Hanrahan from Special Projects, who thinks of everything that I do not. Patrick Dillon, who's our contract manager. Alec Hewless, who's our fiscal director. Denise Kolinkowski, who's our registered dietitian. And you should utilize her if you have a problem with your diet. Call the office because she'd be happy to talk to you and come see you. Margaret Franklin, the aging specialist. Sandy Martin, HICAP director extraordinaire. Nobody knows insurance like Sandy. So if you have a question about Medicare, medical insurance, she's your man or woman. That I should have said. Karen Gosling is our account clerk. She thanks all of you in the restaurant program who have been able to add contributions to support this program. Our intern, Matt Hendrick. Matt is a student at Siena College, and without Matt and his talents, you would all be eating at McDonald's instead of the wonderful restaurants who have agreed to join our Go and Dine program. And last but certainly not least, Michelle Sinato, who is our new confidential executive secretary. In the 2 weeks that she has been in the office, a new calm has settled upon the aging office. I wish I could tell you all the work that these folks do to support older adults. Yes, we do all the programs required, but these folks go the extra mile. They spend time on the phone comforting people, helping them wade through a lot of bureaucracy that is daunting to older adults and maddening to boomers as they approach Social Security and Medicare. Our office staff go to the constituents' homes if necessary for all sorts of reasons. I'm really proud of this staff. I'm proud of the new face that they have put on the aging office, and I am proud of their compassion and dedication to this work. And as Martin Luther King Jr. said, life's most persistent and urgent question is, what are you doing for others? My staff responds to that every day. because the time is always right to do the right thing. Also Martin Luther King. Also here today is Mike Burgess, our chair from Age Friendly. We are grateful for Mike and all his help and his wisdom